The choice between vaginal delivery and cesarean section, a detailed analysis, in the miraculous journey of pregnancy and childbirth. One of the most significant decisions that a mother must face is the choice between vaginal delivery and cesarean section. Each method has its own advantages and disadvantages, affecting not only the mother's health but also the development of the fetus. Understanding the medical and physiological aspects of both methods is crucial. In today's video, we will provide a detailed analysis of these two approaches, hoping to provide valuable insights. Vaginal delivery, the natural choice. Vaginal delivery is considered a natural and less invasive process. This method is often encouraged due to the mother's ability to recover quickly, reduced risk of infection, and fewer postoperative complications. Furthermore, the process stimulates the newborn's immune system through exposure to natural vaginal bacteria. However, vaginal delivery also requires the mother to endure the pain of childbirth and may result in pelvic floor damage, especially when assisted with instruments. The process of vaginal delivery is a natural wonder in the life of both the mother and the fetus. It begins when the mother enters the stage of labor, which is the final phase of pregnancy and typically occurs between the 37th and 42nd weeks of gestation. During this stage, the mother's uterus starts contracting to push the fetus out of the womb and through the vaginal canal into the world. As labor progresses, the uterus contracts and tightens, pushing the fetus from the top of the uterus downward within the womb. Simultaneously, the cervix, the neck of the uterus, dilates, allowing the fetal head to move from the uterus into the vaginal canal. The process of cervical dilation and uterine contractions creates pressure, gradually pushing the fetus downward. As the fetal head enters the vaginal canal, the process of pushing becomes particularly crucial. The mother experiences pressure and pain during this phase. The uterine and vaginal muscles work together to push the fetal head through, aided by the force of uterine contractions and the rhythm of breathing and pushing. In some cases, when necessary, medical professionals and midwives may provide assistance using instruments such as forceps. Finally, when the fetal head has successfully emerged through the vaginal canal and has dilated sufficiently, the mother continues to push, and the cervix opens completely to allow the baby to be born. This is a momentous and miraculous moment when the baby arrives in the world, welcomed with love and care from the mother and family. The process of vaginal delivery through the vaginal canal is an emotionally charged and significant experience in the lives of all mothers, demonstrating strength and a profound connection between mother and child. Cesarean section, intervention when necessary. A cesarean section, also known as a C-section, is a medical intervention performed when vaginal delivery is not feasible or poses a high risk to the mother and baby. This method helps alleviate the pain during childbirth and is sometimes the safest option in cases of complications such as fetal distress, abnormal umbilical cord position, or uterine issues. However, a cesarean section comes with a longer recovery time and an increased risk of infection and surgical complications. The process of a cesarean section, C-section, begins with the preparation of the mother, including marking the abdomen and connecting her to health monitoring devices. Subsequently, the mother is either given general anesthesia or administered regional anesthesia in the lower back or abdominal area. The surgeon then proceeds to make a small incision on the uterus and opens the uterine cavity to access the fetus. The fetus is extracted through this incision and begins to breathe through its own respiratory system. This process typically takes less time compared to vaginal delivery. Once the fetus has been successfully extracted, the surgeon examines the uterus and addresses any other issues before closing the incisions. Afterward, the mother is transferred to a recovery room for health monitoring and the postoperative recovery process. The process of a C-section is a significant medical intervention and is usually performed in necessary cases to ensure the safety and well-being of both the mother and the baby. Impact on the fetus. The choice between these two methods not only affects the mother but also the health and development of the fetus. While vaginal delivery supports the removal of fluids from the newborn's lungs and contributes to the development of the gut microbiome, a cesarean section may increase the risk of respiratory issues in the newborn and does not provide the benefit of exposure to natural vaginal bacteria. In conclusion, the choice between vaginal delivery and cesarean section is a significant decision that should be based on the specific health conditions of the mother and fetus, as well as the guidance of medical professionals. Each method has its own merits and drawbacks, and the decision should be made after careful consideration and consultation with the healthcare team. The safety and health of both the mother and baby should always be the top priority in any decisions related to childbirth.